So one of the key case studies in our handbook is Brazil. And specifically, we did a lot of research on the humanitarian crisis in the Brazil-Venezuela border that has been going on since at least 2018. This study was done in the context of Operação Acolhida, or Operation Welcoming, which is the Brazilian government standard operation for welcoming and processing refugee requests from Venezuelans fleeing their home country and coming into Brazil in the northernmost state of Roraima, which is up north and the only traversable part of the Brazil-Venezuela border. And what we did is we wanted to know how and under what conditions actors used participatory evaluation in Brazil and in Operação Acolhida. So a little bit of what Operação Acolhida is all about. It's, as I said, the Brazilian effort for welcoming Venezuelan refugees into the country. One thing to be mindful of is that Brazil is not the main destination for Venezuelan refugees nowadays. Colombia is. This has to do first with the language commonality between those two countries, but also with the fact that the Venezuela-Brazil border is not densely populated, unlike the Venezuela-Colombia government. So Brazil is receiving a large inflow of refugees. It's large in the context of how many refugees Brazil receives regularly, but is only a fraction of the numbers going into Colombia, which is the other case study that we used in this handbook. There are a very small number of refugees living in Brazil, at least compared to the country's total population. We've recorded a little over 31,000 persons living in the country with refugee status. So it's an issue with very little salience with public opinion, and there is a very limited existing bureaucracy within the Brazilian government dedicated to dealing with humanitarian crises relating to inflows of refugees. On the other hand, the existing framework, the existing laws are quite permissive in the sense that is rather easy for one to get official status as refugees and to live and work in Brazil once they do get that legal status. So what we did with Operação Acolhida, we spent almost a year collecting evidence on how different actors involved in this operation were using participatory evaluation, if at all, how they were going to use these results after evaluations ended, and why, and in the sense why this was important for their work and how they were dealing with this humanitarian crisis in Brazil. So we conducted a number of hours, a little over 12 hours of in-depth interviews with key actors. These key actors were representing organizations involved in the operation. So first of all, the military, the Brazilian military, play a leading role in coordinating government efforts dealing with refugees. There are a number of reasons why, including the lack of a strong, powerful, dedicated bureaucracy to deal with the refugee issue in Brazil, but also with the limited logistics, limited government logistics in the northernmost border of Brazil, which is very sparsely populated and comparatively a much poorer part of the country than the south of Brazil. So we conducted a number of interviews with military officers in the general staff coordinating Acolhida. We also talked to nearly all the NGOs that are involved in doing humanitarian work in the border of Brazil and Venezuela. And we talked to officials in international organizations working in tandem with the Brazilian government on this issue in Brazil. We also, besides the in-depth interview, conducted a survey. It was a systematic survey with over 40 civil society organizations to understand how they were using participatory evaluation and how they were conducting them and how they were using the results of these evaluations, right? And we complemented that with work on official documentation produced by governments, civil society organizations, and international organizations to see what was happening in terms of participatory evaluation in this case. And so from all of this data, have we learned? The armed forces, first of all, conducting no significant systematic evaluations at all, be it participatory evaluations or other forms of evaluation. They had a very tight, very sophisticated system of monitoring, but evaluation was lacking, and there was no real concern with within the general staff with evaluating and drawing long-term lessons, only with monitoring their targets of individuals processed and sent to other parts of the country, which was their goal. The actors most interested in evaluations were national organizations, such as the International Organization for Migration, UNICEF, UNHCR. They conducted a number of participatory evaluations. They wrote reports on it, and they filed these reports. They sent these reports to the Brazilian government, to their headquarters, to local, state, and municipal governments concerned within Brazil. So there was a vast infrastructure of conducting evaluations and participatory evaluations, specifically that was centered around international organizations. NGOs, the understanding of the importance of evaluations, of participatory evaluations, but very few of them had the resources to engage in these evaluations. And there was an issue that these organizations generally perceived this crisis as something temporary, not a main issue of work for them. And so they were not really interested in spending a lot of their resources into learning what was working and what wasn't, so that they could improve their capacity to deal with refugees in the future. Brazil is not a country that receives a lot of refugees every year, and so they thought it was not worth the effort. Evidence, we summarized a few lessons about when evaluations become important and when they're not. First of all, securitization, meaning here the overwhelming role of the military was really an obstacle to evaluation in this case. This is not because we think the military are not interested in evaluations in general, but because they didn't see the operation, this humanitarian operation, as part of their core mission. They saw this as a temporary deployment that was going to end soon, and very far from what the real mission is. So being in charge, they really didn't pay much attention to evaluations and learning lessons in general. A culture of participation doesn't easily translate from one policy area into another. Brazil has a very strong culture of political participation. It has developed important ideas in terms of policy participation, such as participatory budgets and so on. but that didn't translate from areas such as healthcare and education policy, where such evaluations are commonplace, into refugee issues. So the fact that one country has a lot of experience in conducting participatory evaluations in one issue area doesn't mean that they will conduct evaluations in another area. A national culture of participation is vital. Only organizations with a deep experience in evaluating will even consider using these techniques. So the organizations that were most interested in our case were international organizations. They were interested because they have a culture. Normally, in large projects, they will, as a matter of course, conduct these evaluations. So they are the ones with the know-how and the experience to gain the most from these exercises. So this organizational culture is really vital to explain when evaluations will be used and when they won't. Therefore, the fact that the Brazilian government decided to frame this crisis as a temporary emergence really hindered any efforts to draw more permanent lessons. So from the beginning, Brazilian officials thought this was a temporary crisis, something that would not happen very often in Brazil. Brazil is considered not to be a country that is immersed in international flows of refugees. So they weren't really thinking about how they could improve, how they could draw long-term lessons here. And that thinking about this problem as a short-term problem that would not be repeated in the future really hindered any thinking about learning lessons and thinking about the experience of beneficiaries in a more systematic way.